adeno, and large cell carcinoma. So, smoking history is present with all except adenocarcinoma, which also happens to be the most common. Location is central for everyone except peripheral, in which is seen in adenocarcinoma. So, more chances of pneumothorax, etc. Genes for squamous, it is P53. Small is L-MYC, and adeno is your EGFR, ALK, KRAS. Histopath, because it's squamous, you will see keratin pearls. In small cell, you will see azoparty effect, that is the blue discoloration of the cells around the blood vessels. That is your azoparty effect, which is seen in small cell carcinoma. And because it is a neuroendocrine tumor, small cell, you can see salt and pepper chromatin appearance of the nucleus. In adenocarcinoma, you see lipidic spread, which is the butterfly on fence appearance of the cells along the vessels. So that is the lipidic spread, which is seen in adenocarcinoma. Coming to immunohistochemistry, you will see P40 and P63 positivity in squamous cell carcinoma. Because it is a neuroendocrine tumor, you will see the positivity of these markers, which ends in, so synaptogranin, chromogranin, bombesin, and this is NSE, that is neurospecific enolase, which is also positive. Adenocarcinoma starts with A, and so A is the first alphabet, so TTF1 and napsin A is positive in adenocarcinoma. Coming to paraneoplastic syndrome. So you can remember that square of any number is seen or written like this, that is 2 on the top, and so your squamous cell carcinoma will have increased calcium because calcium also has 2 on the top, and it also has increased parathyroid releasing peptide in the blood as a part of the paraneoplastic syndrome. So things to do with calcium is your squamous cell. Coming to your neuroendocrine tumor, your small cell, which is L-MYC positive. You also know there is an N and N-MYC, and also M-MYC, which we will learn in different endocrine tumors. But for here, L-MYC is for your small cell because it has two L in the name. So that has many paraneoplastic syndrome such as SIADH, Cushing's disease, and Lambert-Eaton syndrome. Lambert-Eaton syndrome shows symptoms opposite to that of myasthenia gravis. Coming to your adenocarcinoma, you can remember A for adenocarcinoma and A for avara. That is, the thrombophlebitis will be avara and will be migrating everywhere. That is known as Trousseau's syndrome. That is migrating thrombophlebitis. You will see hypertrophy of the digits, which is your clubbing. So clubbing is seen in which lung cancer, adenocarcinoma, which is also the most common. And there is a merantic endocarditis, which is associated with adenocarcinoma. Large cell is very similar to your squamous cell carcinoma, except you can remember large for large breast, that is gynecomastia is seen with large cell carcinoma. Penco's tumor, it is more commonly a squamous cell carcinoma followed by small cell carcinoma. And the investigation of choice here will be MRI because you will have to see for entrapment of the nerves. While in other lung cancers, you will go for an HRCT. But for Penco's tumor, you will go for an MRI. So we will see congenital pulmonary malformations in our next video.